cases that Mark and I took care of. And this is a lady who had a kind of a cancer in her trachea, a windpipe. You guys ever seen a CAT scan of the chest before? So this is a CAT scan of the chest. And so our patient is laying on her back, and here's the backbone right here. And here's the lung fields. You can see the ribs. This thing that I've circled here is the windpipe. And this is highly abnormal. And so lung tissue normally looks like this kind of charcoal gray with little blood vessels in it. But the windpipe is normally big and round as this red circle. But because of her treatment, which included radiation and laser and other things, she developed a lot of scarring and inflammation, and she was very, very short of breath. And I had to go in and with a scope and blow up a balloon and put stents in. I was working on her probably about once a month for over a year, until I sent her to Larkin. And she started doing the breathing exercises that you guys have just been working on today. You see the difference? And I just saw this patient last week, or not last month, and it's been years now, and she's still doing the foundation breathing at home, and the balloon breathing that you guys just practiced, and she's still doing great. And I haven't had to go down and open her airway up again ever since she started doing this work. Here's another patient. This fellow was a martial artist who had an unusual, rare kind of cancer called a sarcoma. And he was treated with radiation. And he was treated with chemotherapy. And then he had resection of the lung, a part of the lung, a lobectomy. And after all of this was done, he was terribly short of breath. He couldn't even climb a flight of stairs. He was really, really upset. And I sent him to Larkin. He started doing this work that you guys did today. And after about a year, he was back to his usual stuff. It was just amazing. And you can see his chest x-ray is still abnormal, but you can see the improved expansion of the left lung, right? So the rehabilitation effect of doing this kind of thing is profound. So this next guy is a keyboard player who you just heard some of his stuff. And actually, I wound up in the hospital as a fluke last year. I had something called viral pleurisy. And I discovered that I actually had something else. It turns out that a few years ago, when I had developed a case of shingles, I had developed a paralyzed right diaphragm. So this is my chest x-ray. Here's my heart. This is my left lung, or right lung. This is the right lung. This is the left lung. This right here is the diaphragm, and normally these should be about the same height, right? See how high this one is? Because it's not working right. I was pretty upset when I saw that. Let's just say that I got religion. I've been doing Pilates for a while. We went back and started doing the breath work that you guys have done today. And 5 months later, this is my chest x-ray. You see any difference? See how the diaphragm has come down? See how the lungs have expanded? Right? So, I don't think that my diaphragm function is perfect, but, you know, this is what rehab is. Rehab helps you make the most of what you've got. There's something else I want to tell you about oxygen. This is kind of interesting. Another piece of my research that I was involved in for many years was a kind of treatment where oxygen is actually used to treat cancer. Did you know that oxygen can be used to treat cancer? So there's a kind of treatment for lung cancer and also for other cancers. It's approved for bladder cancer and esophageal cancer. And it's called photodynamic therapy. And what happens is we give a patient a dose of a drug. This drug is actually a cousin of hemoglobin. Your hemoglobin carries oxygen. So this is a breakdown product. It's hematoporphin. The drug by itself doesn't do anything. But when we give it in the system, it circulates and then collects inside the tumor. And it sits there. So you give the patient a dose of the drug, say on Monday, and then a couple days later, you go down, for lung cancer, we go down in the airways with a scope, with a bronchoscope, and we shine a red light on the tumor. The red light by itself doesn't do anything. It's like what you scan your groceries with. But the light and the drug together produce singlet oxygen. It causes the drug releases oxygen inside the cells, cancer cells, and it kills the cancer cells. So we know that oxygen does have a profound effect on cancer cells.